Good morning parents, good morning students. It's a principal's update for you on World Health Day, which is wear yellow. Clearly I'm in a yellow t-shirt today, like many of our sixth form here and staff here today. So I wanted to give you an update on where we are with the COVID situation and talking about COVID jabs and also changes that will be happening from Monday this week coming. So first of all, we've seen a rapid rise across Birmingham. I'm sure you followed that on the news, but certainly in schools you've seen a rapid rise in the number of people that are off school at the moment with COVID or with symptoms that could be COVID. So from Monday, just to clarify, we will be going back to level 1 measures within AUEA. Level 1 measures means that students will be required to wear, and staff will be required to wear masks around the academy, in all communal spaces, around the corridors, and ultimately from a perspective of stand up, they will mask up. They won't be required to wear masks when they're sat down in their lessons. We will continue to carry on the rest of the procedures, the cleaning procedures, the doors open procedures and the airflow procedures. Our standard procedures will also continue, including making sure students wash their hands regularly for the day and when they arrive in the school and when they leave. And obviously where possible, we will maintain social distancing, but clearly students will be obviously operating and sitting together in their normal classes. So all students will be given a mask on Monday. We've got a supply here to be able to give every child one mask, but as you're aware, clearly with these disposable masks, they do need to be replenished and replaced, and therefore we're just giving you the notice across this weekend. Please do go out and stock up if you haven't already got masks at home with masks, please, that your students and your children can bring with you next week, please. So just to confirm, from Monday, all students and staff will be wearing masks around the academy in all areas, apart from when they're sat down within their lessons. The other thing we've been notified now is the COVID jab for students of age 12 to 16. Clearly, any student above 16, which is the top of year 11, certainly 12, 13 and 14, can still go and get their jabs in the community. And I encourage, and I know many of our students have actually done that already. But we've now been given our date for the one single jab that's going to happen for those students from 12 to 16. Now today a consent form will be given to every single student in the school to take home and to be brought back next week, obviously if you provide your consent. Now the position that the government and the legal position on this is that any student over the age of 12 can make their own choice to say, I wish to have the COVID jab, because they're deemed old enough to make that rational decision, which is understandable and fair. However, myself, as the school, along with other schools in the local area, won't be operating that. We will very clearly be operating on a parental consent only. Okay, absolutely, that child should feel they can talk about whether they want the injection, but that is something and a conversation we encourage you to have at home. But therefore, after that, it requires the parental consent. So I wanted to reassure you that we will only be helping to administer by passing through to the professional team. And just to confirm, it's not staff here, it's not myself. We will not be going around doing the COVID injections. The normal public health immunisation team from Birmingham will be coming into school on the 20th. So they will only be able to have a COVID jab if you're between the ages of 12 and 16 if they have a signed consent. It cannot be on the day, it cannot be by phone, it can only be by the official form which your child is bringing home with them today. So please keep a lookout for that. It is a personal choice for you, and obviously clearly it's, we would want to see as many people as possible potentially having the COVID jab, but it is an absolutely personal decision for you and your family to discuss, and I'll just ask you please discuss that at home and find out where does your child sit with those decisions as well. The other thing we've picked up from the COVID jabs is that it has been a bit of a trial and error in terms of how the actual organisation of that's gone, but also in terms of supply as well, also connected into things like the HGV shortages we've seen around the country as well. So what has happened over the last couple of weeks when the jabs injections have started and immunisations have started at other schools is that not every single person who has consented has actually been and received their COVID jab. So we will be really really keen to, and most importantly, chasing down those that are wanting to give consent as soon as possible, so we can notify the immunisation team to really push to make sure that we've got the right number of vaccines at AUEA, because clearly if you've gone to the process of knowing that you want the vaccine for your child and then the disappointment of finding out they've come in and they haven't received that. So to try and mitigate that, it is really important we have those consent forms back as soon as possible. They will be done in the hall. Students will be brought down from their classes. They will go through, as then they're delivered, they're done by nurses and part of the immunisation team. They'll then sit there, and for those parents who've had their own COVID jabs, you'll understand the process, a very similar process. They'll have their in a jab in an arm of their choice, and then they will sit down there and have 30 minutes while we will obviously monitor them and check them. It's not unknown that students, like adults, can after having their COVID, can feel ill for a little bit of period, and clearly you'll be working with parents, and if that is the case, the appropriate way of obviously ensuring they come home, if that's the case, to work with. The last bit for me, really important, is how we are asking for your help and support with ensuring that we try and minimise the cases and reduce the risk of having to send students home. And clearly the biggest impact is if I lose my teachers, I therefore can't maintain the education at the establishment. And that is the recommendation, please, and the request that if there is somebody in the household, be it parent, grandparent, sibling, who has COVID, even if the child that comes here does not have COVID, is that you allow the 3-day incubation period remaining at home. What we're seeing with this increase in cases is students coming to school, they're fine, they feel well, they don't have it, but brother, sister, mum, dad, somebody in the household does have it, and then within 2 days and 3 days, they're off with COVID, because clearly that incubation period, it takes a while to work through different people. What that means is over those 3 days, that's where we're seeing the increased chance and risk of that person not yet having symptoms, but be in the position to spread COVID. So to really help with that, please, can you ensure that if there is, and I know a lot of you are doing this already, that if there is somebody in the household itself who has COVID, please can you make sure that the child that comes to AUEA stays off for those 3 days of incubation. If after 3 days they still don't have any symptoms at all and they've got a negative lateral flow test, at that point they can return and carry on going to AUEA as normal, because it may be that they are resistant to the COVID disease anyway. So that's a real positive to come through. I'll remind you that there's you can reach out at any point via principalpa@auea.co.uk. Please do, if you've got any questions. I really appreciate that. I also wanted to highlight, as mentioned, there's a number of jobs that we've been looking for, and especially in terms of supporting in the school, and they're on our website and on our test site as well. So please do have a look at those, and we look forward to catching up in person very soon. Take care. Bye.